Good morning. Good morning, Dr. Kim. And thank you so much for being here this morning, and especially for being a supporter of the AHA, American Heart Association, here in Metro Detroit. And before I get into our questions surrounding the research you are doing, would you please tell our audience more about you and your goals as the Director of Cardiology at the Henry Ford Medical System?
Well, first of all, thank you so much for inviting me to be with you today, Steve. It's really a pleasure and an honor. So I'm the division head of cardiology at the Henry Ford Hospital and for the Henry Ford Medical Group here in Detroit. I'm also the interim medical director for the Henry Ford Health System Heart and Vascular Service Line, overseeing operations and clinical care for cardiology, cardiothoracic surgery, and vascular surgery. So prior to these positions, I was also the cardiology fellowship training program director at Henry Ford for 12 years.
Wow. Wow, that's fantastic. Great to hear. Thanks for that information. And just to move forward, well-planned strategic research is both critical and vital to saving lives. So much so that the American Heart Association designates a large portion of its funds raised to this purpose. Would you please highlight some of the current research as it relates to hypertension and heart health that you and your team at Henry Ford Health System are working on, and why it is important to our community?
Well, let me say that the Henry Ford Health System and the American Heart Association have really had a long history of partnership in fighting cardiovascular disease and stroke. So each year, the Henry Ford Health System selects one major fundraising campaign to support as part of a larger commitment to support our communities. And I'll tell you, as long as I can remember, that organization has always been the Heart Walk campaign to raise funds for the AHA. And I'll tell you that this partnership has really been enormously successful, with Henry Ford raising over $4 million over the past 17 years to support the AHA. Those funds raised by the AHA are so critical to fight cardiovascular disease. As many of you may know or not know, that it's the #1 killer in the United States. And at Henry Ford alone, the American Heart Association has provided over $922,000 in research grants over the past 5 years. And in total, with that partnership, the AHA has funded over $13.3 million in research grants to the Henry Ford Health System. And I'll tell you, some of the things that these grant dollars have gone to support have included 3 to 4 year career development awards for 4 of our investigators: Dr. Pablo Ortiz, Dr. Mariela Mendez, Dr. Suresh Palyandiani, and Dr. Paulo Caceros in our Division of Hypertension and Vascular Research. These research grants are absolutely critical to supporting these scientists as they seek to understand how hypertension, inflammation, and diabetes all mechanistically contribute to the development and progression of heart disease. And specifically, their research supported by the AHA has led to the discovery of new genes involved in salt handling by the kidney, which is, again, critical to the understanding of the pathophysiology of hypertension.
Ooh. Wow, this is so great. It's amazing.
If you have some time, I can mention some more research that's been going on as well, just because it's been, I think there's incredible research, not only just in hypertension, but Dr. Michael Chop is a senior neuroscientist, really making exciting discoveries for many years with the AHA support to understand the role of diabetes and a variety of novel proteins involved in stroke injury and potentially the treatment of stroke. Also, finally, one of our senior scientists, Dr. Hani Sabah, received the American Heart Association Seymour Golden Award for distinguished achievement for his many discoveries understanding the basic mechanisms in the development and evolution of congestive heart failure. Again, all this could not be possible without the vision and support of the American Heart Association.
That is fantastic. So needed. Especially, I look at diabetes. Still, high blood pressure, the silent killer. And with diabetes, it's just everywhere. It's such a scourge when you look at the incidence of diabetes in our country. Is just unbelievable. So, and I think getting into especially the gene study sounds so fantastic, and it's so great that you're working with American Heart and raising money to fund this fantastic research. So just coming back a bit to our community, why is this American Heart Association research funding especially helpful and timely for our city in Detroit?
Absolutely. I mean, I think it's very important to point out that the American Heart Association does a whole lot more than support academic research, which it does, certainly, as I just pointed out. Aside from the amazing world-class science and discovery that occur at great academic bioscientific research institutions in Detroit, like Henry Ford, the HA also supports many programs and initiatives in our city to truly make a difference in the lives and communities we serve. So just to give you just to point out some things, the HA has provided over 500 community members with nutritional food boxes and resources to maintain a sustainable, heart-healthy diet when, especially at these times, food insecurity is really at its highest.
Amen.
HA has provided over 450 self-monitoring blood pressure cuffs to vulnerable populations with hypertension. As you pointed out,
Yep.
diabetes and hypertension and obesity really are an epidemic.
Yes.
In our inner cities, and all of those, combined are just terribly. Those things together really contribute to the cardiovascular disease we see in our vulnerable populations. Yeah. The American Heart Association has supported over 50 federally qualified health centers. They provided training and technical support to over 100 houses of worship wishing to develop vacant land into affordable housing. They provided tobacco endgame toolkits and other resources to over 100 schools all throughout the state of Michigan who are dealing with this vaping epidemic, which is also a terrible scourge on our society.
Thank you for getting into that. That's a real issue.
Absolutely. And the HA has also been critical to training over 300,000 Michigan residents each year in CPR to help those patients who have sudden cardiac arrest in the communities. To have a population that knows how to do CPR is critical to helping people survive until trained medical help can arrive. In addition, the HA has invested in our youth, preparing them for success through physical and emotional well-being. This includes in-school programs like the Kids Heart Challenge, where over 100,000 Michigan students have participated in this program over the past 3 years. So really amazing work.
That is fantastic. It's exciting when
Absolutely.
you think of all that's going on. And thank you for educating us on all that's being done and how funding really does affect our communities and our kids, which is so critical. But looking at a broader scale, how can research like yours impact communities not only in Michigan and the Detroit area, but across the country in helping save lives?
Yeah, well, as I mentioned earlier, cardiovascular disease is the #1 killer in the United States.
Yes.
United States, excuse me.
Yep.
And one major problem that has been well documented is that vulnerable and at-risk patient populations are significantly underrepresented in clinical trials and research that we do.
Yep.
And at a time when we're increasingly recognizing the importance of genetics and the contribution of social determinants of health and disease, it's really critically important to support research that helps us to understand these very complex issues. I'll tell you, with respect to the COVID-19 pandemic recently and how terribly it impacted Detroit and many of our major cities, that made this incredibly clear.
Yes.
So before we understand how biology and the social determinants of health and disease interact and intersect, the greater the impact we can make in fighting all types of medical conditions and improve the well-being of all the patients and the communities we serve.
Yeah, you're exactly right about that with the COVID-19. It certainly had an impact of even highlighting obesity as a comorbidity. So whatever we can do, a lot of it can be presented, a lot of it's lifestyle change. But of course, that's one of the biggest challenges ever to change habits. Really, really difficult. So looking at, again, back at COVID, how has it impacted the work that you do? And if so, and if yes, how?
No, absolutely. As I mentioned, I think that we're just starting to understand the COVID-19 disease process, and we certainly understand and have found that patients who are at particular risk of mortality and morbidity from COVID-19 have underlying cardiovascular disease. So those are patients who are particularly at risk. So the more that we can do to understand who those vulnerable patient populations are, treat the underlying conditions that contribute to mortality related to COVID-19, then we can, manage and hopefully control this this disease and infection better, and hopefully improve the outcomes.
I really agree. And, you look at lifespan, you look at mortality, and, lifespan is one thing and the other is well-span. And how much of your, if you have comorbidities, leading towards congestive heart failure, I mean, you may be living, but are you living well? And so that's another critical feature of making preventive changes. It's just your life is going to be more of a life if you really work hard on your lifestyle.
Absolutely. And there are things, obviously there are things that you can't control, like you can't control your parents.
That's right.
But there's certainly many things that you can control, like your lifestyle. Absolutely. You can control, what you eat and whether you exercise, whether you smoke, all those things, whether you control your diabetes and high blood pressure, all those things that will, contribute to your, health and prevent cardiovascular disease. Absolutely.
Yeah. And then of course,
of the American Heart Association, and it's been a great partnership for us at Henry Ford to achieve those goals.
Yeah. Well, this has been a fantastic opportunity to have a discussion with you today. And we really appreciate all that you're doing along with your team and how you're partnering with others to make an impact really to our country and to make us a much more healthy country, a stronger country. So thank you so much, Dr. Kim.
No, thank you so much. It's been a pleasure. And again, it's been a great partnership with the American Heart Association.
Well, we appreciate that. We appreciate you. You go out and make it a great day.
You too. Thank you very much.
All right. Thank you.